And okay, we're live right there. And so we just went live, but people, it takes a little while for people to get the. Let me close this out. Back to newsfeed. Just get, oh, Joey. It's a little. It just takes like probably about 30 seconds or so to get it. Okay, copy. All right, then I can close this. Go here, put it there, and publish it there. Publish it there. And I can close this out. Okay, that's published. And oops, right here. And start recording. All right, we're live. We're live with Karin Caroll, who is the head of the health department of Gloucester, Massachusetts. Did I get it right?
You did. Good job.
Great. This is the new normal. We do podcasts with using Zoom, and I think Zoom stock is going to go through the roof because it's a way for people to communicate, and it's a good way to practice our social distancing.
Right. Yep.
So
A little different than when we met a week ago. Things are changing fast when we were all together and around that table. But yeah, this is our new reality for now.
This is it. So last night there was Governor Baker gave a conference. There's a conference every day, but
He just gave one. Yeah.
Yeah, and the latest one was talking about. Why don't you explain what it was? Because you're the professional,
Sure.
and I'm just here to be the platform.
Okay, great. Yeah, and stop me if you have any questions.
Great.
Yesterday afternoon, Governor Baker gave an update. He's doing a press conference pretty much every day these days. He did one just a few minutes ago, ended just a few minutes ago. And he talked about a number of measures that they are taking at the state level to increase supply of testing equipment, test sites, and medical supplies, how they're going to support local boards of health in monitoring this whole situation. So it was great. There was a lot of good information yesterday. And one of the big announcements out of yesterday's press conference from the governor was, well, there were two things. One was a stay-at-home advisory. So that's different than an order, but it's an advisory. It's a strong recommendation coming through the Department of Public Health out of the governor's office that says we advise you to stay home and limit unnecessary travel and unnecessary activity. So any non-essential activity. So that doesn't mean you can't go out for a walk. It doesn't mean you can't drive to get your groceries, gas, medicine, or if you're one of the essential workers and need to go to work, those are all fine, of course. So that was the big announcement. And then the other announcement came out was that for non-essential businesses. And there's a really long list that you can find on mass.gov. But essentially, if you're not in some way helping this towards the COVID response, either making parts or working in a lab that's contributing, you're supporting the healthcare field, the healthcare workers, first responders, then you're considered a non-essential business and you need to close down.
What about food? What about food people?
Any food production of all kinds is considered essential. So pet food, any kind of food, candy,
and distribution.
Yes, right. So anything to do with their business. Now, even those businesses that are allowed to stay open are still asked to try to put non-essential people in their office, let them work at home. Right. Keep people 6 feet apart any way you can creatively. So if you're an essential business that's staying open, like some departments in the city, we work from home when we can. As you can see, I'm here. We stagger schedules so that we don't have more people we need in the office at one time. These are all strategies, and our community development office has been working round the clock with our businesses, offering them technical assistance on how to do this, how to stay open, how to sanitize, how to stagger workers, and who's essential, who's not essential, so that they can keep people out of the office if possible.
Right.
And I think people are doing a good job with that. There's definitely been a lot of confusion around things like construction workers. Are they essential or not? Kind of depends on what they're building. But there is guidance. If you go to mass.gov, and you'll see there's a coronavirus link at the top, and it has all of the governor's orders as they come out and as they're revised. So you can actually see his order. You can see the language that if you're allowed to stay open or you're not allowed to stay open. And if you are allowed to stay open, what you're required to do as well. So I encourage people to have a look at that.
Okay.
Yeah.
I just put as you're going in the chat. I'm placing. I said to go to mass.gov for information. So
Yep.
so how do you access? How will you if you need a city service right now? Because you're the Gloucester
Yep.
Health. So we're going to try to keep this
Yep.
to Gloucester. Oh, we just lost. Let me just see. I think it's coming back right now. Oh my goodness. Connecting. What the hell? Stay with us, folks. We're just seeing if we can get this feed back up. I don't know what happened. Okay. There. I don't know if it's. I'll ask her to. Let me just see here. Let's say. I'll have to invite. Stay with us. I'm going to invite her to join again, and she'll be right back with us. Invite. Let me just make sure this isn't given. Okay. Email. Sorry, folks. Sending. So I'm sending her a new invitation to this meeting, so just bear with us. Okay. Okay. So she's going to get this invitation, and we should be back up and running any second. Sorry about that, guys. I don't know if it's me or what it is, but she should be back. Tell you in a second here. Sent. I'm communicating with her through the texting to let her know that there's a invitation there. Hopefully she can get right back on. This is the new reality. This is what we got. This is what we got. Is this type of we're using Zoom, our technology right now. You have to enter in a few credentials, so it takes a few minutes. In the meantime, the chat should still be up. So let me know if anybody has any questions. Anyone have any questions? Oh, here we go.
Okay.
Yeah, you are. You're back. Thank you.
You're back. I don't know what happened. You just froze totally.
Yeah, no, I think there's.
All right.
Yeah. Okay, let me just get you back here.
Keep going. I do have a 2:00 call, but other than that, I'm okay.
Okay. All right, sounds. Let's get to it then. What am I doing here? People can hear you, so you can just.
Okay.
Can you see me right now?
I can see you. Yeah.
Okay, I'm frozen, but the main thing is they can hear you. So.
Okay.
Yeah, so let her rip.
All right. So why don't I just kind of give an overview and work through, and then if you have questions, stop and ask me for sure. Right now, as expected, we have seen a lot of increased activity. We knew this would probably happen, especially as the testing has become a little more available. It's still, there's still slow in spots, but in the last week since we spoke, there's certainly been big jumps in numbers, and I can update you on the state level. This information is also on mass.gov every single afternoon. They update it. So at the moment, there are 777 cases in the Commonwealth of Massachusetts. There are 73 cases confirmed here in Essex County. And there are several throughout the Cape Ann area. We had 5 or 6 as of yesterday, and each of our Cape Ann communities have cases now. So it's real. We're not surprised by this, and it's unfortunately where we're at with all of this. And I just want to explain to viewers how the process works. So if you feel unwell or you meet the criteria that you've had an exposure to someone with COVID-19 diagnosis or to traveled from one of the countries that are listed as high risk, you would reach out to your family physician. And that's really important. That's the first step. They are the only ones that can order a test. So even if you found your way into some testing center and you were in line ready to go, you're going to get bounced back until you have some paperwork that only a licensed provider in Massachusetts can give you. And they have to get that through DPH. So it's a little bit of a process. And also, we want to reiterate the health department doesn't have staff available, nor are we doctors or nurses, and we're certainly not your doctor or nurse, to give advice to people, and we would hate to give the wrong advice. So it's important that if you are concerned about yourself or someone in your family having an exposure or having symptoms or not feeling well, or just a potential exposure, you have to work with your primary care provider on that. And we hear from people all day long that they're really concerned about this. And we understand that concern, but we have to direct you where you belong with your healthcare provider. If you don't have a healthcare provider, we strongly suggest that you get one. Last I checked, the Gloucester Family Health Center was accepting new patients. I don't know if BI Leahy partner Beth Israel Leahy practices are accepting new partners or patients or not, but you can certainly check with them. And if you don't have a primary care provider and you have children or your loved one does, work through their provider. So that's our first thing I want to advise people. So if you go about the process, you work with your provider and it's determined that you do need to have a test for COVID-19. They'll organize that test when and how they can. There is a little delay, but they'll get that test as soon as they can. And then the result of the test goes to the state lab. And that's the point in which it's confirmed and it's put into a state database that there is a confirmation that your test came positive, like all communicable diseases. So, this is not a new system for this disease. We do this all the time. And if there is a communicable disease in a community that gets diagnosed at a doctor's office, it gets reported always to a local board of health. And the local board of health can take the appropriate precautions, and they'll do what we call an epidemiology investigation. It's a big word for, they'll look into the case. They'll look into who might have been exposed, the onset of symptoms, when things started, how close someone who at the infectious point of their disease was in contact with others. So it's a complicated process, but our nurses and epidemiologists at the state do this all the time. And they do the same thing for COVID-19. So they reach out to you or I, they call us, they tell us we've been confirmed as positive. And then they go about the process of working with you to identify your close contacts if you're the person with the disease. And then they go about the process of contacting all of the close contacts and asking those folks, most likely will be told to quarantine, depending, depending on what others, if there's symptoms going on. So it's a whole kind of complicated process. And as you can imagine, these aren't fast phone calls. There's a lot of questions when a patient's diagnosed they have for our nurses. So we're keeping up at the moment, but there can be a delay. So we want people to understand that the cases that get tested, first of all, once we have results, then there is a process in which we will contact people. And we do have a group of school nurses working with us and some contract nurses, as do all of the communities, but we're all faced with a workload that we've not seen before, and it's growing daily. So we're also faced with some challenges we haven't thought a lot about, like people don't have landlines anymore. So it's not always super easy to find somebody's phone number.
Hmm.
And so we spend a lot of time tracking down how to get a hold of someone. And so this is something that, we're concerned at the state level about this, about how to make sure there's enough nurses and epidemiologists available to support our local nurses in these calls. They don't work. We don't have a 24/7 office. Gloucester is one of the bigger health departments, and we have one public health nurse. We brought on some extra folks to help us, but it's a dilemma for the entire state, probably the country as well, with this particular situation is just so unique in so many ways. So it's really stretching a lot of resources.
Is the main reason for trying to flatten the curve because there aren't many respirators produced yet, and they're trying to catch up with what they anticipate as the demand? Are the respirators the number one thing, or is there some other piece of equipment that they're really just trying to manufacture and get to the different cities and hospitals to? Because if it and you just tell me where I'm wrong or whatever. I'm just going to throw stuff out and you correct me.
Okay.
If someone's lungs fill up and is I think this is the main problem, and they get fatigued, especially older people. The respirators are what can keep the oxygen flowing to where that needs to go. Am I right there?
Yeah, if someone gets sick enough that they need either respirator, intubator, they're gonna be very sick, and they're gonna be in our intensive cares, in our hospitals. These are good questions for the hospital right now. It's hard to know. You talk to, like, I don't speak with everyone that's actually in the hospital, but I know from the city point of view, we have first responders that we're concerned about having enough masks and gloves and PPEs, we call them, personal protective equipment. So everybody along the line, and including the doctor's office that needs to test these people, has to have this protective equipment so they're not exposed. So there's an awful lot of steps in which we want to protect our frontline healthcare workers. So from the minute they go in for the testing, the patient, to if they need an ambulance ride or a 911 call, those police and firefighters that are arriving on the scene. And that's the part that's concerning, where there is a lack of all of this protective equipment, as well as the tertiary supplies you're referring to in the hospital, and the beds and the ICU staff. I mean, all of those kind of more extreme resources that, we are, yes, concerned that they'll be tapped. But there's all of these needs before that are already being strained, and we can see daily there are requests through to the state for N95 masks and gloves and basic PPEs that every healthcare first responder should have if they're in a potential risk situation. So yeah, to answer your question, where exactly if this curves happens, if we can't flatten it, it's going to really impact a lot of us, a lot of frontline people, and a lot of our resources will be tapped. So that's why we want to slow down this rate of exposure, hospitalization, all of that.
Because it is sort of inevitable that a lot of people are going to get this, right?
Yeah,
Inevitably, yeah.
yeah,
So
yeah. I mean,
people shouldn't freak out about that.
right.
Like do what
It's
you
like the
can,
flu. Yeah,
right? It's
yeah,
like the flu.
exactly.
You
There are some things that are different about this virus, but a lot of people will get it, and most of us will get it and maybe not even know we had it, stay at home, recover, hopefully eventually build some immunity to it. But the other thing that I can tell you about this flattening of the curve that's really important to remember is that in healthcare, we learn from the data. So if we can have a slow and steady progression of this outbreak, we will start to learn what therapies, what kind of a support, supplemental stuff we can do that helps patients. There may even be, as you've heard in the news, there may even be other drugs that start to become available in the weeks, months ahead. So part of the importance of slowing down the rate of people getting sick with this disease is to allow us time as a system to, one, get supplies, and two, learn how to best cope with this, how to best, what advice to tell people. We are learning daily about this virus and, you know, how we can help people. So we're learning things about the virus itself daily that we didn't understand previously. For example, how long it can live on a surface. Now, we're now finding out it can probably live quite a bit longer than we thought, several days,
Wow.
maybe even weeks. So that will change how we deal with it and how we clean surfaces and you know, how long in between. So these are all really important things. And the more time we have to learn about it, then we can use that knowledge to help the next lot of patients coming through to have better outcomes.
Yeah.
So that's the other part of flattening the curve that I think is really important for people to understand.
Now the city still has to operate. Um, how are they going to deal with public meetings? And if you need to kind of communicate, what is the best way for people to
Right.
communicate with the city?
Great question. I'm glad you asked that. Because I sometimes forget the whole rest of the city is running all its normal business. I mean, it's all a little bit unusual for all of us, but the city is open. All the departments are open. They are not open to the public, so that's the difference. But staff are working at home. We had our mayor's manager meeting this morning on Zoom. If you need someone in the city, you would email or call them like you would normally try to do that.
And that's on the email addresses, just about for everybody, are on the city website.
Yes,
Okay.
yep. Our mayor's office is doing a great job getting all of this information onto the city website every day. It's updated and there's lots of great resources for people, local resources as well, not just the city. But the city has really, you know, done a great job of figuring out how to have public meetings through Zoom. That information's on the website. And again, if you're trying to contact someone, leave a phone message. You know, we might not be in our office, but
Right.
our IT department's fabulous and they've found a way for us to get our messages via email. So, you know, if you need someone, leave a message, and when someone they'll get back to you. Again, we would follow the governor's requirements about non-essential services as well. So, you know, things that are non-essential to provide, we won't be providing at this point. But the staff are available, the mayor's office, the city hall, you know, they're all available in the normal ways that you would try to reach us. So feel free. I do want to, again, add one caveat about the health department. If you're calling the health department about COVID-19 issues, again, if you're an individual concerned about your own exposure or, you know, someone you love, someone you care about, you really need to go through your primary care provider. You can also call the state's hotline, which is 211.
Oh,
That's
I'm gonna,
and yep, 211.
211.
Yep, and they're open around the clock, and they can answer a lot of questions. Be patient; they may
One,
have to call you
one
back.
second. I just want to make
Yeah.
sure in the notes, I write this the right way. 211 is the number for what?
It's called the Massachusetts Hotline for COVID-19.
Okay, thank you.
Yep, and it's run out of the Massachusetts Department of Public Health. It's staffed by people who can answer your questions. They can help refer you to services that you might need, or even help you link up with a provider if you don't have one. If you have general questions about COVID-19, they're a great place to start. And the other thing they just instituted today that the governor told us about was a texting hotline. So if you text this number, I'm going to give it to you now, 888-777.
Yep.
Yep, so text that and you
Oh, just 6 digits?
yep, 888-777.
Okay,
And
okay.
in the text box for your message, you just write COVID-MA, all one word, COVID-MA. And then the state's committed to sending us updates as they come out about this situation. So that would be another great thing that people can do to keep informed if there's any big changes or things coming out of the state. They will be letting people know.
Okay.
So moving on, so I think we talked about the city. And again, the city website is a great source of
I,
information.
I have a question. So I'm asking people if they want to ask questions of you. So I'm going to read one of the
Okay,
questions. Charlene Ellis McCarthy. She wrote a note. I noticed a lot of people who have been tested for coronavirus have been negative. Does this mean that their symptoms are attributable to the flu or some other cold that they have?
could be. Yep, could be.
Okay.
As we know, the COVID symptoms aren't anything too unusual. They're cold-like. Um, when they get more severe, they can be a little bit different, but they can present like a cold. Some people report, scratchy or a little bit of a cough. Some people don't report feeling anything. Again, there are different reasons why people get tested. And in the beginning of this, it had to do with your travel risk. So now that the travel has stopped, or people are that's not so much an issue. But yeah, it is true that there are a lot of people get tested. There's a lot that come out negative. I don't know that percentage yet of
Is it
how
four?
many
Is it
are.
four? I'm sorry. Is it 14 days? After 14 days, you can feel pretty rest assured that if you haven't traveled within 14 days, that you're less of a risk.
That's correct.
Okay.
The 14 days is the quarantine time if you had a known exposure from traveling. Yep.
Okay. Yeah.
If you develop symptoms and are diagnosed, it's a little bit different calculation. Again, this is where it gets complicated, but we won't go into that.
Okay.
Yeah. So, and if you're asked to quarantine, it is usually for the 14 days from the point of which you were exposed.
Great.
Or, if you have symptoms, again, that changes the equation.
Andy Lee just wrote in. He just signed up for the text updates. Very easy to do. Thank you. Thank you very much.
Good.
So
Okay, that's
yeah,
great.
yeah.
Yeah, I mean, the governor's office is providing some great resources. The last few days, especially, they've had these regular updates with a lot of good information. And, they're looking to help us problem solve. So we're in constant communication with them as well about what resources we're worried about or what issues we're trying to resolve at the local level. And like I explained before, the amount of nurses we need to call people and their contacts is definitely something we need their help. And I know they've been talking to medical schools and public health schools about maybe utilizing some students. I don't know how that will all play out, but we were really pleased to hear that they're exploring those things. Yeah.
Okay. As far as the schools, what can you tell me? How are we
Yeah.
working with the schools right now?
Yeah, I mean, I have a college student and a high school student, and they are, it's clunky, but they are getting some classes online. I know here in Gloucester, we had this morning, our superintendent was on a call, and he's explained some of the steps the schools are taking. And it's a whole new world, but they're doing it. They're figuring out ways to Zoom with their classes, do different types of assignments, enrichment assignments, so a little bit different. And it's a challenge, but they're working through it. Um, Dr. Safar did say that for students on IEPs and needing special assistance, that the staff within his community are reaching out to those families individually that might need a little more support. And they're figuring it out. They're providing meals to students every day, and I understand that's going well. So yeah, I mean, it's a challenging time. It's strange, but I think the schools are doing a great job of trying to adapt to this on the fly and work with students. So I do know that's happening. I was also going to tell you a little bit about something happening for seniors that people might know about. Again, this is a really high risk population with this disease. It does seem to affect older people,
Seniors, yeah.
although, yeah, older adults. We are seeing more younger people actually get COVID-19 and have symptoms and illness and even hospitalization. So we we are definitely seeing that trend here in America more than some of the other countries did, certainly China, and we don't really understand why. But still, our highest risk for severe complications from this disease fall to that older adult category. So we've been really focusing and partnering with our Council on Aging in the city, our Open Door, senior care, to make sure we're doing everything we can and be as creative as we can to support our seniors, making sure they're safe at home. I know that Scott Trenty and Lucy Sheehan from our senior offices told us today they're both doing well check calls for thousands of their patients on Cape
Wow.
Ann, of their clients. So they're just reaching out to make sure people know who to call, they have what they need. Um, they were also explained to us this morning that they're still taking intakes, new intakes. So if there is an older adult who needs home health, they can still contact senior care and they'll do the intake. And if you don't want people coming into your home right now, that's understandable. They can provide some home health help with things like delivering groceries or medicine. So I thought that was a tremendous service that they've been able to, again, quickly adapt to and provide. And I want to make sure that folks in the community know those things are out there. Meals on Wheels is still operating. The Open Door Food Pantry is not open for people to come in, but they are providing free food and delivery and pickup for all kinds of individuals in the community. So we can't, express how grateful we are to these agencies who work and are making sure that our most vulnerable are safe. So again, those are people that are great to support as well as Action. If people want to donate volunteer support, those are great local agencies. And there's many others who are doing so much to kind of look after their population of their clients. So we appreciate that.
There's traditionally, Thanksgiving is a time when Open Door gets a lot of attention. I can't think of a time more important to support Open Door than right now. They could use help. We'll put a link in the show notes on how you can help support the Open Door
Yeah.
project. I put in the comments. I expressed what you had just mentioned. Contact Senior Care for help. They are offering services like delivering groceries and medicine, which
Hmm.
some people don't have families. So
Right.
if you have if there are older people on your block or whatever, maybe pick up the phone and see if there's anything you can do to help. We're all in
That's
this.
right.
Definitely all in this together. If ever we're all in
Yeah.
this together in our
Yeah.
lifetimes. I mean, we're not at war, but we're at war.
But
So
yeah.
you know.
Yeah. Yeah, exactly.
So
Right. And anything that you can do to check on seniors to make sure they are aware of these resources or to offer to pick up some groceries for them. Again, a lot of the grocery stores are providing an early morning shopping time for seniors, which is fabulous. The store is clean and well stocked at that time. It makes it a little easier for older adults, but we still don't want large groups of people together at any one time. So it's still good to limit those trips.
make them
And
purposeful. So when
make
you
them
go,
purposeful.
get a lot at
Uh,
once, so you don't have to
yep.
go back and forth.
Or combine lists with a friend, or if you have someone in the community that's willing to do your grocery shopping for you, that's great too.
Yeah.
To really limit the number of times you're out and about and exposing yourself.
I noticed that Stop and Shop, they have installed, and I haven't been to any of the other grocery stores, glass panels in between the cashiers and the patrons, right where you check your groceries.
Okay.
And also, speaking to the checkout person, they said that the early morning for seniors thing has helped to spread out the day, the people entering the grocery store.
Okay.
So that's nice to hear.
Yeah,
Let's
that's
see.
good.
Yeah,
Yep.
yeah,
Yeah, that's what we need to do is spread out. If you have to go out and
spread out.
shop,
Yeah.
spread out, spread your trips out. If you can order some things online, do that. It's all
Uh,
about reducing those exposures.
we should also mention what we're using right now is called Zoom.
Yep.
So it's great for families. It's great
Yeah.
for friends. I know,
Yep.
like I'm going stir crazy. I know a lot of other people going stir crazy. When
Yep.
we're moving the podcast to this format.
Yep.
So if you haven't looked it up, it's a free service. So check
Yep.
out, go on, just Google it, Zoom, and use it to to have
Yeah.
your social interaction. Social interaction to me is very important.
It
'Cause,
is,
you
it
know,
is really important,
yeah,
Joey. It is
yeah,
really important in this sort of unsettling time too, where people are worried, they're concerned, and it's hard to feel isolated. I think we're all experiencing it, and every age group has its own challenges with this. But I definitely think you're spot on with that. I encourage people to try to do a conference call, try to do a Zoom. We set it up. My kids and nieces and nephews with my parents on Sunday night had dinner as a family all over
oh, that's great.
Massachusetts.
Yeah,
But it was really great for them to see us and to know we're all there. I think it is really important. Friends can get together this way, but also to get outside. It's okay to be outside. It doesn't mean you're in lockdown in your home. It means you shouldn't be within 3 feet of anybody.
right.
So try to keep that in mind. Go for a walk. Try to get outside a bit. Sit out on your deck on some of these nice days and give yourself that space to,
If
you
if
know,
any, if any place has some nice open space and trails, it's our area.
yeah, yep,
You have Ravenswood, you have the back
yeah,
shore, you have
yep,
there's Halibut Point is a great place to take a walk. If you take you can go for a ride. It doesn't hurt to go for a ride. Go up to the Ipswich Wildlife Sanctuary in Topsfield. That's a great place to take a hike.
yep,
Planning to
yep.
do that with my daughters tomorrow. So.
Great.
We got a comment
Great.
from Charlene Delaney. She says,
Okay.
don't forget Meals on Wheels, senior
Oh,
care.
yep.
They need wipes and sanitizer. Bob Ryan at Ryan and Wood just told her that they've been approved to make sanitizer and they will be selling it at Ryan and Wood.
Great.
So that's great.
Great. Great.
Meredith Fine chimes in that you are the Karen Caroll is the best. And we are so lucky to have you. I know you have to go to another meeting, so if there's anything you want to close with, you can close right now.
Yeah, yeah. One more thing, and I just thank you, Meredith, for those nice words, and for everyone. People have really come together. We have an extraordinary community, and everyone has found a way to be helpful and supportive, and that's super. Our mayor's office, as you all know, is so passionate and concerned about her residents. So it's a great team. We're all exhausted, but when you have that kind of team support, it keeps you going. And our first responders, the whole 9 yards. I also wanted to just one more thing about mental health. And again, this is a passion of the mayor's, a real concern of the mayor's. Our department also does a lot of work and really it's a big issue for a lot of people. So we'll be posting some resources on our websites. We're exploring with the mayor's office different ways to get this information out to people. But I can recommend a great guide that I saw the other day from NAMI, which is nami.org. And again, I'm not sure what it's national, maybe mental health or something organization, forget the acronym. But
That
they
is for what?
have
Sorry.
it's mental health resources. It's a national organization that's kind of a leader in mental health, and they put out a guide to COVID-19. And it goes through every emotion you or someone in your family might be experiencing. It has a great index, so you can kind of go through whatever your concerns, anxieties, what to do about it, how you're feeling, to turn to for help. So it's a great guide if you want to put that up or resource for people as well. That would be super. So again, nami.org.
We have it in the. I put a link to it. There's one more question, and we'll leave it at this. What about friendly dogs? Sometimes you can't help but pet, even just to move them along, but not a real petting. I mean, I'm hearing that pets
Is that
can't. I
is
don't
it
know.
a metaphor? Is that a metaphor for something, or is it a question about real dogs? I'm
Yeah,
assuming real dogs.
yeah.
I think that the last, I'm pretty sure that CDC has now said you can't get that dogs can't get it, but you would have to check on the CDC website for sure.
Okay.
I don't
All right.
remember the latest. It's certainly not the primary means of this disease transmitting people. It's again, it's going to be high touch surfaces, arms laying around on your phone, on your doorknob, that then you touch your face. That's going to be the main transmission, or someone sick, sneezing and breathing on you. So, it's still those main sort of ways that the virus is transmitted.
And we should say that a lot of people are going to get this. Not to freak out.
Yep.
you know, we're
Right.
handling that just, you know, the initial ones that come in and you hear about, I think is an initial shock to people, but
Yeah.
over time you're going to hear about quite a few people getting this. So, you know,
That's right.
that,
That's right. And remember that, there's a lot of people that aren't tested and people can be carriers. So,
right,
we could all have it and we may get it. We may know we've got it. We may not. But that's why the social distancing is so important that you really don't know the size of the problem. And in order to prevent the people who are going to get it and get really, really sick from it, we've got to stay apart. So that's
absolutely.
kind of, yeah,
Thank
yeah.
you.
And how long to wash your hands for? Joey told you this the other
It's
day. How many seconds? This is a quiz.
it's two times you saying happy birthday twice.
That's right.
There you
That's
go.
right. 20 seconds or happy birthday twice. Nice
Right.
job.
There you go. Thank you. Thanks for coming on. I know you have to get someplace else.
Yep.
We'll be sharing this on Good Morning Gloucester. It'll be on the Facebook page.
Super.
And please, if we can ask you anything, share this interview so other people can get the information. There's a lot of great resources that you just
Great.
alerted people to. Thanks again.
Great. Okay. Thank you. Take
We'll
care.
see you.
Stay